A very good morning. Welcome to this edition of News for the Hearing Impaired. I'm Rukma and with me is Manisha. Let's begin with the headlines. Prime Minister Narendra Modi to share his thoughts in the monthly Mann Ki Baat program at 11 a.m. today. Program will be broadcast on entire network of All India Radio and Doordarshan. Group of Ministers reviews current status and action for management of COVID-19 in its 13th meet. Health Minister Dr. Harshvardhan commends the collective efforts of all stakeholders in combating COVID-19. Home Ministry clarifies that the latest relaxations in lockdown restrictions pertain only to shops selling items. Those rendering services such as restaurants, salons and barber shops will remain closed. Liquor stores will also remain closed. Inter-Ministerial Central Team writes to West Bengal Chief Secretary, seeks clarity on stand of state government on facilitating visits of IMCT and ensuring its safety. Total COVID-19 cases in India stand at 24,942. Active coronavirus cases 18,953 with 779 fatalities and 5,209 recoveries. Worldwide battle against COVID-19 continues. Global death toll crosses 2 lakh mark, while death toll in UK crosses 20,000. Over 28.9 lakh people infected so far. And now for our top story, Prime Minister Narendra Modi will share his thoughts with the people of India and abroad in his Mann Ki Baat program on All India Radio at 11 a.m. today. The program will be broadcast on the entire network of AIR and Doordarshan. The program will also be available in the website of All India Radio News, www.newsonair.com, and News on AIR mobile app. It will be broadcast in regional languages immediately after the Hindi telecast on All India Radio. The program can be heard again in regional languages at 8 o'clock at night. This will be the 64th episode of Prime Minister's Mann Ki Baat broadcast. And as for updates regarding COVID-19 in India, latest updates of the Ministry of Health and Family Welfare show that the country has 18,953 active cases, where 5,209 are fully recovered and discharged, while the total death toll has touched 779. Maharashtra continues to remain in the worst hit state in the total number of infected cases, followed by Gujarat. Delhi occupies third position with more than 2,500 positive cases. 7 states, including Uttar Pradesh, Tamil Nadu, have crossed the 1,000 mark. From 8 a.m. on Friday to 8 a.m. Saturday, India recorded 6% growth in new cases. This is the lowest daily growth rate recorded since India crossed 100 cases. The 13th meeting of the high-level group of ministers on COVID-19 was held at Nirman Bhavan in New Delhi on Saturday under the chairpersonship of Union Health Minister Dr. Harshvardhan. A detailed presentation on the status of COVID-19 in the country along with the response and management of COVID-19 were made for the group of ministers. Detailed deliberation on the measures taken as on date by the centre and various states and union territories for prevention, containment and management of COVID-19 took place. The GOM was informed that all districts have been asked to follow and further strengthen their contingency plans to combat COVID-19. The GOM was briefed on the state-wise details of dedicated COVID-19 hospitals, along with the adequacy of isolation beds or wards, PPEs, N95 masks, drugs, ventilators, oxygen cylinders, and so on. The GOM was informed that domestic manufacturers which have been identified earlier have already started production of PPEs and masks, and adequate quantity of the same is available. The GOM also reviewed the testing strategy and availability of testing kits across the country, along with the strategy for hotspots and cluster management. And the GOM was also informed that a national level metadata of health workers, NSS, NYK, NCC, doctors, and so on has been prepared and shared to all states, districts, and other officials to mobilize the resources and volunteers, COVID warriors, to much needed locations. In view of queries coming from various sections of society, the Home Ministry today issued a clarification that in rural areas, all shops except those in shopping malls are allowed to open. The revised order implies that in rural areas, all shops except those in shopping malls are allowed to open. In urban areas, all standalone shops, neighborhood shops, and shops in residential complexes are allowed to open. Shops in markets and market complexes and shopping malls are not allowed to open. The spokesperson said that all states have to strictly follow MHA directions.
जो आपदा प्रबंधन अधिनियम के अंतर्गत जो गृह मंत्रालय के आदेश हैं वे सभी राज्य सरकारों के लिए अनिवार्य हैं। राज्य सरकार इन आदेशों को डाइल्यूट नहीं कर सकती, इनमें जो प्रतिबंध लगाए गए हैं उनको डाइल्यूट नहीं कर सकती, पर अपनी स्थानीय ज़रूरतों के अनुसार उनको और स्ट्रिक्ट या सख्ती से पालन कर सकती है। जो शॉप्स आइटम्स बेच रही हैं वो शॉप्स तो खुली रह सकती हैं, लेकिन अगर वो शॉप सर्विसेज प्रदान कर रही हैं जैसे हेयर कटिंग या ब्यूटी ट्रीटमेंट या स्पा वगैरह, उनको अभी खोलने की अनुमति नहीं है।
MHA further clarified that sale by e-commerce companies will continue to be permitted for essential goods only. It is further clarified that sale of liquor and other items continues to be prohibited as specified in the national directives for COVID-19 management. As specified in the consolidated revised guidelines, these shops will not be permitted to open in areas, whether rural or urban, which are declared as containment zones by respective states and union territories. It would be mandatory for all permitted shops to open only with 50% strength of workers, ensure compulsory wearing of masks, and strict adherence to social distancing norms.
ई-कॉमर्स के लिए अभी पुराना ही नियम लागू रहेगा। ई-कॉमर्स के अंतर्गत सिर्फ एसेंशियल आइटम्स यानी कि आवश्यक वस्तुओं की बिक्री की अनुमति है। अभी ई-कॉमर्स के अंतर्गत कोई और सामान का ऐड ऑन नहीं हुआ है।
In the wake of the lockdown ease by the Home Ministry, bookshops are reopened gradually. The decision to relax the lockdown restrictions has come in the backdrop of improved doubling rate in the country. Different parts of the country are experiencing the relaxation with the strict compliance of physical distancing, while bookshops, sweet shops have reopened. In Arunachal Pradesh, the state government in an order has lifted restrictions on various activities like food processing and cottage industries. According to the order, food processing industries and other industries operating in rural areas, including stone crusher, sawmills and bricks, are allowed to function while maintaining measures of social distancing. Meanwhile, life in the state is picking up pace and small-scale business establishments, as per instructions and guidelines, are getting ready to be functional. A central team on a visit to West Bengal to assess the COVID-19 situation in the state has flagged non-cooperation on the part of the state government over providing logistical support and other relevant information. In a letter to Chief Secretary Rajiv Sinha, the interministerial central team, led by senior bureaucrat Apurva Chandra, also sought to know details about steps taken by the state government to identify and quarantine those who returned from the Tablighi Jamaat congregation in Delhi's Nizamuddin area. Chandra said the team is yet to receive a response from the state government to letters it had written to Sinha since its arrival in the city on Monday. It has stated that none of the 4 letters written by the team have been responded to by the state government so far. The team has lamented that despite requests, it has not been provided with any police escort teams to visit the designated areas for fieldwork. To date, the team has also not been provided any PPE kits for visit to COVID-19 affected areas and hospitals. Delhi government has increased the number of corona containment zones in the city to 95. 3 new hotspots were created in the last 24 hours. These are Gully number 3 and 9 of Shalimar village and Block 10 of Yadav Villa in northeast Delhi. Orders have been given to seal this zone under Operation Shield of Delhi government. And the Delhi police on Saturday conducted a flag march in COVID-19 hotspot of Chandni Mahal in the city. Police made an appeal to the people to cooperate by staying at home. DM Nidhi Srivastav was also present. And Union Minister Prakash Javadekar has lashed out at the opposition Congress party, taking objection to the recent comments by the Congress leadership. Union Minister Javadekar said that while the entire world has been praising India's efforts to contain the spread of COVID-19, the Congress is indulging in politics.
देश जब गंभीर संकट से जूझ रहा है और सारी जनता जब प्रधानमंत्री के काम में हाथ बटा रही है, तब कांग्रेस ओछी राजनीति कर रही है, नकारात्मक राजनीति कर रही है। रोज चिट्ठियां लिख रही है। भाई फील्ड में जाकर काम करो ना, वो तो नहीं करते। यहां नई नई मांगे मांगते रहते हैं। पूरी दुनिया प्रशंसा करती है कि भारत ने सही समय पर और सही तरीके से लॉकडाउन किया और इसलिए हमने देखा है कि कितना अच्छा प्रभाव हुआ है। लेकिन जिसकी पूरी दुनिया प्रशंसा करती है, कांग्रेस उसका विरोध करती है और उस पर सवाल या निशान उठाती है।
Environment, Forest and Climate Change Minister Prakash Javadekar on Saturday interacted with members of the Rotary Club through video conferencing. While interacting, he said that a smart campus competition for colleges will be organized soon, where colleges will be awarded on the basis of greenery, waste, water and power management, among other things.
Greenery, area ka planning, landscape planning, power, saving power, generating power, saving water, generating water, treating the waste properly and waste management on the campus. ये सब पहलू और इको ट्रैवल, साइकिल, ये जिस कैंपस में होंगे उनको पुरस्कार देते जाएंगे।
Terming Prime Minister Narendra Modi as the best taskmaster, the Union Minister said that each Union Minister has been given the responsibility to monitor development work in 15 to 20 districts.
12 बजे तक उनका काम चलता है, सुबह 6 बजे से फिर शुरू होता है। तो ये कंटिन्यूअस काम करने वाले हैं और इसलिए सबको पहुंचते हैं। आपको पता नहीं होगा, हमें सभी मंत्रियों को 15-15, 20-20 जिले बांट कर दिए हैं। कभी जिला के जिलाधिकारी से हम बात करते और क्या बात करना है, रोज अलग अलग मुद्दे। एक दिन हम पुलिस कमिश्नर से बात करते, एक दिन वहां के हमारे भारतीय जनता पार्टी के कार्यकर्ताओं से बात करते, एक दिन हम बाकी समाज के जो गणमान्य लोग हैं और विभिन्न क्षेत्रों को रिप्रेजेंट करते उनसे बात करते, यानी हर एक को पूरा काम है. ही इज द बेस्ट टास्क मास्टर आई हैव एवर सीन.
The spread of misinformation in the times of COVID-19 pandemic can lead to stigmatization, which is equally dangerous as the disease. In this backdrop, Niti Aayog on Saturday conducted an interactive session with civil society organizations and NGOs on stigmatization of COVID-19. Niti Aayog CEO Amitabh Kant and top officials of the Ministry of Health and Family Welfare participated in the discussion. Amitabh Kant said that the need of the hour is to be more sensitive in the way we communicate, to be more compassionate in our messaging, and to understand that there is no need to panic. And Joint Secretary Love Agarwal appreciated the efforts of NGOs and CSOs in spreading the message of social distancing. He also urged them to actively join the government's efforts in eliminating the stigma associated with COVID-19. The CEO of Niti Aayog, Amitabh Kant, has said that India's timely decisions have improved the doubling rate of COVID-19 from 3 to 12.53. In a tweet, he said, and I quote, "Pandemics such as COVID require tough and timely decisions from governments. India's timely decisions have improved the doubling rate from 3 to 12.53. If we had not acted on time, we would have had over 10 lakh positive cases today, almost 44 times higher than our current number of cases." In Bengaluru's Victoria Hospital, the medical fraternity is using technology to fight coronavirus in order to maintain adequate distance. The hospital uses remote control technology to ensure safety for doctors and health workers treating COVID-19 patients. This comes as a new initiative to reduce contact with patients. The Nepal government has extended suspension of domestic and international flights till May 15th as a precautionary measure to contain COVID-19. The decision was taken at a meeting of the High-Level Coordination Committee for the Prevention and Control of COVID-19 held in Kathmandu on Saturday. Earlier, flights had been halted until April 30th. A total of 49 cases of COVID-19 have been reported in the Himalayan nations so far. According to the Ministry of Health and Population Nepal, 12 persons have recovered, while remaining 37 are undergoing treatment and their condition is normal. In Sri Lanka, the ongoing curfew in 4 high-risk districts, including Colombo, has been further extended till 4th of May in a bid to tackle the COVID-19 crisis. Curfew in rest of 21 districts will see relaxation from 5 a.m. to 8 p.m. and will be lifted from the 1st of May. Curfew in these low-risk districts was relaxed on weekdays this week but was reimposed during the weekend. Meanwhile, 15 fresh cases of COVID-19 were reported on Saturday, bringing the number of active cases to 312. 7 persons have died and 116 have recovered out of a total 435 infections in Sri Lanka. The maximum number of 52 cases was reported yesterday, which included 35 Navy personnel. In a related development, another batch of 163 Sri Lankan students who were stranded in Mumbai were repatriated yesterday afternoon. The World Health Organization has said that there was currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second coronavirus infection. In a brief, the agency has warned governments against issuing immunity passports or risk-free certificates to people who have been infected, as their immunity is not guaranteed. The practice could actually increase the risks of spreading the disease, as people who have recovered may ignore advice on taking precautions. Chile said last week it would begin handing out health passports to people who had developed antibodies to the virus. They could immediately rejoin the workforce. Meanwhile, WHO continues to review the evidence on antibody responses to COVID-19. New York Governor Andrew Cuomo on Saturday said that the state will begin conducting antibody tests for workers at 4 hospitals hit hardest by the pandemic. Antibody testing is a way of determining if a person has been infected by the virus, even if they had not shown any symptoms. The state will also allow local pharmacies to begin collecting samples for diagnostic tests. Under a new executive order, Cuomo plans to grant independent pharmacists the authority to conduct diagnostic tests for COVID-19. Collected samples will be tested at labs off-site. This could add an additional 5,000 testing locations in New York State. Meanwhile, in a new tally, the U.S. recorded 2,494 more coronavirus deaths in the past 24 hours. The country now has an overall death toll of 53,694, with 9,36,293 confirmed infections. Again in the U.S., as researchers scramble to find a way to safely disinfect N95 masks for reuse, many are turning to the man behind its virus-blocking technology. Peter Tsai invented the filtration fabric inside the mask nearly 30 years ago and spent decades perfecting it before retiring from the University of Tennessee last year. But with hospitals facing mask shortages across the country amid the coronavirus pandemic, hospitals find a ray of hope in his guidance. And the materials scientist and engineer is now joining the effort to find a way to safely sterilize the N95 mask considered essential for medical personnel. And Spain's health authorities say 2,944 new COVID-19 infections were confirmed in the previous 24 hours, taking the total to nearly 2,23,759 cases. In this connection, the Spanish Prime Minister Pedro Sanchez announced, while addressing to the nation, that people will be allowed out to exercise from May 2nd if the number of new coronavirus cases continues to fall. He also said that the government on Tuesday will explain the de-escalation plan after a weekly cabinet meeting. Since Spaniards have been living under one of Europe's strictest lockdowns since March 14th, they are allowed out for food, medicine and essential work, but not to exercise. The total fatalities in one of the country's most badly affected by the virus has risen to 22,902, and the overall number of cases stands at 2,23,759. In Italy, police deployed their eyes in the sky to monitor citizens ignoring lockdown measures to contain the coronavirus outbreak. Videos shot from helicopters over Milan and Rome showed virtually deserted cities with few people out of doors. Deaths from the COVID-19 pandemic in Italy climbed by 420 on Friday, the smallest daily tally since March 19th. But the number of new infections rose to 3,021. The total number of fatalities now stands at 26,384, the second highest in the world after that of the US. The number of confirmed cases rose to 1,95,351, the third highest global tally behind those of the United States and Spain. France reported 516 new deaths from the novel coronavirus in the last 24 hours, bringing the overall toll to 22,614 fatalities on Saturday. However, the number of patients in intensive care continues a 2-week decline, falling by 165 over 24 hours to 5,053. Although hospitals across France are still receiving a steady stream of new cases, the overall number of those who remain hospitalized with the virus continues to drop. French authorities say the coming days are key if the country is to be able to meet a May 11th target to begin a gradual end to national lockdown. Britain has become the fifth country to have the highest official coronavirus death toll in the world, after the US, Italy, Spain and France. The British government says it is too soon to ease a nationwide lockdown imposed on March 23rd and extended to May 7th. Interior Minister Priti Patel repeated the government's message to the public on Saturday to stay at home. Meanwhile, Britain Prime Minister Boris Johnson will return to Downing Street on Monday following a stint in intensive care that could have gone either way. The Prime Minister will confront a series of urgent decisions, including whether the United Kingdom's lockdown should be eased to help revive the devastated economy or remain in place to avert a feared second wave of the disease. Johnson has been recovering from coronavirus at his country residence since being discharged from St. Thomas's Hospital in central London on April 12th. Superheroes like Spider-Man, Batman, Flash and Thor have been seen working on the streets of Lisbon on Saturday. From garbage collectors to delivery drivers, the unsung heroes of Portugal's coronavirus lockdown were seen delivering their duties in superhero costume as part of an innovative campaign. The campaign was launched by Lisbon's Santo Antonio Parish Council, with often overlooked workers going about their daily routines dressed up as their favorite superheroes. The campaign aimed at recognizing their superhuman role in keeping the capital city on its feet. Portugal, which has been under lockdown since March 18th, has so far reported 23,392 cases of the new coronavirus and 880 deaths. Let's now examine the facts behind some information floating around during the outbreak in the country. A regional newspaper had carried a report which said lack of infrastructure, equipment in district hospital Tamenglong, a serious concern for denizens on 22nd April. The story claims that there is a lack of preparedness as the district hospital does not have testing kits, ICU bed or ventilator. Rebutting the claims made, the Assam Health Department has stated that the district has been provided with 8 consignments of COVID-19 prevention items and has 8 isolation beds. Since at present there is no ICU bed dedicated for a COVID patient, no ventilator has been assigned to the hospital. The statement further adds that Manipur has 2 ICMR approved COVID-19 testing at JNIMS and RIMS. Any misleading report on preparedness due to non-verification of facts leads to panic and confusion in the public and as such harms the common resolve to defeat the pandemic. The Assam Health Department has also requested the said newspaper to withdraw the news item from its website. Well, with that, we wind up this edition of news for the hearing impaired. Namaskar.